Welcome back to the Daily Drum on WHUR and Sirius XM Channel 141. This is the Insight segment. I'm Harold Fisher. This is a Wellness Wednesday, and tonight we are hearing a very personal, very intimate story about breast cancer, the struggle, worry, and quite frankly, the fear of diagnosis, the challenges of treatment and recovery, and the triumph of being able to call oneself a survivor. This is an extremely important conversation about the emotional journey of the disease. My guest is Deidre Owens. She is a public relations executive and president of DOT Communications. She is also a colleague and a friend. Now, before we get this conversation started, I do want to warn our listeners that there may be some emotional triggers in this conversation, but we are having it because it is so important that we look at the personal side of a breast cancer journey. Deidre, thank you so much for joining us to talk about this.
Thanks so much, Harold. I'm happy to be here, and hopefully my experience will motivate others to stay on top of their mammograms and the self-care that we all need to do.
Well, I must say, I am particularly happy that you are here to talk about this. We have been friends for a long time, you and your sister, and both of you are friends of the Howard University Radio Network, specifically WHUR. And so this is also personal for me as well, to be able to sit down and really talk to you about this. You are a very young 57.
Thank you. I like to think so.
Looking like you're 40.
Thank you.
But I want to start. Well, first of all, how are you feeling?
I'm feeling really fantastic. I mean, obviously, cancer is frightening regardless of the stage or type. Mine was caught very early. I had access to incredible medical care, which I know is not always the case for everyone. And, I wouldn't wish this experience on anyone, but so many positives came out of it. Mm-hmm. It taught me so much about myself. Obviously, it gives you a lot of perspective. Mm-hmm. We live in Washington, D.C., and also as a business owner where we work. We're always on the grind. But it really helps to put things in perspective about what's important, who's important.
Yeah. I have, plans to get to all of those things, but I want to begin by starting at the very beginning. Talk to me about the initial diagnosis. What was happening in your life leading up to this? Did you have any idea whatsoever in the weeks or even months prior to your diagnosis that there was a problem?
No, this was just actually my annual mammogram. I had scheduled it the same day as my wellness exam with my OBGYN. It was in late July. It was a beautiful day.
Of last year?
Mm-hmm. Fortunately, I work for myself, so I took the day off. So I had a lovely, I had a visit with my OBGYN. Then I had a great lunch. Then I went and had my mammogram. And because I have cystic breast, I'm very vigilant about getting my annual mammogram. And
cystic breasts?
I have dense breast, and a lot of women, some women may have cystic breast. And oftentimes they do have to take more images because of that. Mm-hmm. So I wasn't alarmed when they said, oh, we need to take another set of images, because that's happened before. What hasn't happened before is that they wanted me to stay and then talk to the doctor. while I was getting my mammogram. Now that had never happened before. And, and I was by myself. So that was a little unnerving to say the least. And, they walked me down this long hallway and I could feel like I could almost hear like this music in the background. And the doctor sat down with me and they noticed a cluster of cells that weren't there in my previous mammograms that were concerning to them. And they wanted me to come back for a biopsy. And obviously, that was concerning. But they were cells. So that gave me a little comfort. There was no visible lump that I could have felt or that, my doctor felt. And it happened a few days before I was going on vacation. So I left on vacation. And of course, that was kind of in the back of my head. So I came back, I had the biopsy, and the biopsy was on a Monday and I got the result on a Friday. I was in the line. I was at Home Depot, actually. I remember when I got the biopsy, the nurse said, if I call and it's me, then there's nothing to worry about. If the doctor calls, then, there's something there. So when they called, I saw the number on my phone. I heard the nurse's voice and she said, "I'm going to transfer you." And I was like, "Oh, don't." And she transferred the doctor. And, the doctor shared that I had stage 0 cancer, which again, was surprising and scary, but I was like, this is great. It's so early, So the following week I had scheduled an appointment with the breast surgeon, Dr. Allison Bruff, who was amazing. And she was very transparent that, it's stage 0. They were going to schedule a lumpectomy. And then I was to have 6 weeks of radiation. Well, 4 surgeries later, things didn't go according to plan.
What do you mean by that?
Well, it was stage 0, but the way the cells were, they were scattered. So after my first lumpectomy, my margins did not come back clean. It was still showing cancer, which I did not expect, nor did they, but, it happens. So then I had a second lumpectomy and the margins did not come back clean. There was still cancer present. And that was extremely frightening. And I'm not a doctor, so I don't want to try to give it in medical terms, but the way the cells were scattered, it fortunately was still stage 0. They were going to have to continue to cut. So we made the decision that a mastectomy was the best option. And at that point, going into a third surgery, I just chose to do a double mastectomy just to lower all chances of recurrence. And many people say, well, that must have been such a difficult decision. Actually, that was the easiest decision. At that point, I just wanted to, lower chances of recurrence and really just get all of the cancer. So that was the best decision for me. And what I learned, there's so many different types of breast cancer. And obviously we know there are different stages and everyone's experience is so different. And, there's so many different treatment plans. But that was the best decision for me. And after the mastectomy, I decided to do reconstruction and get implants. And, fortunately I had so much support, friends, family, medical providers. And one of the things that I often say is the bad thing is I got a chance to talk to so many breast cancer survivors that were in my orbit that I never even knew ever experienced breast cancer. But the good thing is that I did talk to so many because they're still here, So, it was a frightening experience because it didn't go according to plan.
Talk to me about the support system, the
Mhm.
initial support system. As I mentioned at the beginning of this conversation, you and I have been friends for a while. Your
Mhm.
sister uh, Deborah is also
Yes.
a colleague and a friend. And what were the conversations with Deborah like in talking to because Deborah, and she's a wonderful person. She's
Yes.
a uh, if anyone wants to have a great sister,
Yes.
Deborah's
She's
the
the
one to
ultimate
have.
Yeah, she's the ultimate big sister,
Yeah.
and I like to say she would not allow me to go to a medical appointment by myself, even when I wanted to.
Mhm.
And it's so important that you have an advocate because oftentimes, you're in those appointments and there's so much information that that they're sharing that you need to be aware of. But I found myself at times like zoning out because it was almost too much to comprehend. And then you're in it still in a state of shock because it's not like I felt sick or I wasn't feeling well. So I feel like there was a few months that I was like, do I really have it felt so surreal. You know what I
Mhm.
mean? And Debbie was there every step of the way. Those moments that I was really scared, when after that first surgery where they came back and there was still cancer. Your mind is not your friend in times like this. You're thinking, has it spread? You know, um, what's really going on, and she was there every step of the way, to listen. And, when I was not thinking rationally to get me back on track, that regardless of what the process was, the outcome was going to be positive. We were going to take the necessary steps. And oftentimes your biggest fear is, oh gosh, is it cancer? Well, yes, it is cancer, you know, and the hardest part for me was waiting for those results from the biopsy. But once I got that, we were able to make a plan with my medical providers, my surgeons. We made a plan. Even when things weren't going according to plan, we had to pivot, and we did. And one of the things that I learned early on is that I could not do online research.
Why
You have
that's interesting. Why do you say that?
Well, because there's so much information. You don't know, are all of the sources reputable? You don't know. There's so much information. It was going down a rabbit hole. And of course, I'm not a medical doctor. I don't know this person's medical history. So I really had, and, I'm a person that likes to feel a sense of control, like
Yeah.
a lot of us do. But, I had to trust my medical providers. I had to trust that I had identified the best medical providers for my situation. And I worked with them on the information. And if I did need to go and get additional information, I did do that.
Hmm.
But there has to, there at a certain point, you have to trust the providers that you're working with. And
Hmm.
and if you do have to get a second opinion, by all means do that. And of course, I'm a big believer in therapy, and I had a therapist, and I'm working with a therapist now, and she's more of a coach, um, to just help you through this process.
Hmm. Yeah.
Because it is a process.
And I did want to. Are you referring to Melanie Nix?
Yes,
Yeah, because
yes.
I want to talk about that too, because you said she's a coach, and she's so much more. I mean, and let us not even limit the broad spectrum of her experience, because she's a patient advocate. She's also a breast cancer survivor,
Mhm.
um and a person who also is a uh, is a marathoner, among other things. She's done quite a bit, and I really want to talk to you about that broad swath of support, not only with
Yes.
family, but also with Melanie and, of course, your physicians. But I need to
Mhm.
take a really quick break and remind our listeners that you can hear this and every edition of the Daily Drum Insight segment via podcast on our website, WHUR.com. The original Quiet Storm with Raheem Devon is coming up next on WHUR-FM. You'll hear the rest of this conversation continuing on Sirius XM channel 141 and 96.3 HD2 in just a few seconds. Welcome back to the Daily Drum on Sirius XM channel 141. I'm Harold Fisher. We are continuing our conversation on this Wellness Wednesday about the personal side of breast cancer. My guest is a breast cancer survivor, Deidre Owens. She's a public relations executive and president of DOT Communications. She is a colleague, but she is also a friend. We want to warn you ahead of time that there may be some emotional triggers in this conversation, but we are having this very personal conversation, this intimate conversation about the breast cancer issue, particularly as it relates to coming out on the other side and being able to call oneself a survivor. Before the break, you were talking about Melanie Nix and
Mhm.
having a breast cancer coach. Explain that.
Well, I think it's so important when you're going through something. Obviously, I've never been through it before.
Mm-hmm.
There's no need to go it alone. And one of the things that my mother taught me, which I'm so thankful, is that, if there's something you can't do or you don't know, there are resources out there. If you need help, ask for help. If you can't figure it out, go to somebody who has figured it out, right? And one of the things I learned, there's so many resources available, especially in the DMV, for people who are going through breast cancer, um, post-treatment, whether it's support groups, peer-to-peer counseling, alternative therapies that are available for cancer patients at no charge. There's the Smith Center in DC, right off of U Street. They offer a whole host of programs and resources at no charge, from Reiki therapy to, support groups, to patient navigators who can help you through the process. Again, because of early detection, I did not have to do radiation or chemotherapy. But that's a whole nother process. And obviously, so many people have been impacted. There's no need to try to reinvent the wheel or to figure it out, by yourself.
Mm-hmm.
As someone who's, fairly independent, it was a struggle asking for help at times.
Tell me about that.
I mean, I think you like to think that you can figure it out. You know what I mean? Um, but emotionally, you only have so much bandwidth, right? And physically, I had 4 surgeries in an 8-month period. Physically, I needed a lot of help. That was really hard. You know, um, it was hard, you know, needing assistance in and out of a car
Mm.
or up and down the steps after surgery.
So
Or
tell me, explain that to me from the perspective of getting an understanding, because I'm not sure, and I know I do
Mhm.
not. I mean, it's one thing if pull a hamstring. It's
Right.
it's one thing if you uh I don't know, have a fractured bone in your leg, and so
Mhm.
no, you can't walk the steps. You
Right.
can't do. But after the surgery,
Mhm.
you know, describe the kind of physical limitations, like you said, getting out of the car.
Right. Well, I guess for me, I had 2 lumpectomies, which they were still surgeries, what they were minor. What I call the big surgery, the mastectomy.
Mm-hmm.
Surgery number 3 was major surgery. I'd never had major surgery. I'd never had drains. I had surgical drains that, you had to drain and measure the contents. I needed help showering, you
Wow.
know? And, for someone who considers themselves fairly independent, who had never had any health issues before, that was really hard. It was hard for me to see the changes that my body was going through, and I didn't have reconstructive surgery right away. There was a 3-month period where you have these expanders in your chest that's preparing your skin for the implants. And for all intents and purposes, I was disfigured for those 3 months. It's hard physically to see a body that doesn't look like the body
When you looked at yourself in the mirror, and
Mhm.
I'm sure you did, were you able to do that right away, or was that a process?
No, I was not able to do that right away. And
Mhm.
it's so funny. One of the things a friend asked me the other day, what did you learn, during this process? What are some of the things that you learned? And one of the things I learned, Harold, is that you don't always have to look. I was always that person, like I always had to know everything. I always wanted to look and I always wanted to see. There was like probably a 3-month period where I didn't look in the mirror because I couldn't. It was just too much, and luckily I had a sister who would, if anything had to be applied topically, she would do that. It was very difficult. And I had to just hold on to knowing that this was a temporary situation, but it's hard looking at a body that you don't recognize, you know, that's hard. Um, and that was very difficult.
Take us back to that first day when you did finally
Mhm,
gather the courage to look at yourself in the mirror.
mhm. Yeah, it was difficult because you're looking at something that you don't recognize,
Mm.
and it was hard. And you kind of have to relearn your body, right? You have to reacquaint yourself with your physical self that looks different.
Mhm. How did you I know these are very simple things,
Mhm,
and there are so many women who are probably listening to this who have been through this experience and are able to proudly wear the label of survivor. But then
mhm.
there are some people who have no point of reference. I mean, how did you sleep? What did you have to sleep on your back? Did you have to sleep
Yes,
up?
I
How did
yes,
that?
I had to sleep on my back for, gosh, I can't remember how long, but for a while. And I ordered one of these, I call them contraptions, but one of those big kind of, pillows from Amazon. It was like 8 pieces, you could go really high or you could be midway. And I slept like that for a long, long time.
Mhm.
So there was a period where physically I just wasn't I was just not comfortable for a period of time. And I just had to get comfortable with being uncomfortable, if that makes sense,
Mhm.
you know? And
Was there, once you went through the expander part
mhm,
of this recovery process,
mhm,
um, uh, at the risk of sounding silly, how did you
mhm.
choose your implants?
Yeah, that was an interesting part. You meet with now my breast surgeon, Dr. Brock, that was different from my plastic surgeon.
Hmm.
So, some people decide to go smaller, some people may decide to go larger. I just wanted to be made whole. I just kind of wanted to go to, my original size. So they do a determination. You meet with them, they kind of identify what implant is best. And then that surgery happened. And actually, I'm very pleased with how they look. They look very natural. I feel very comfortable in my skin. They're a little firmer than my old ones. So I'm happy about that.
The old ones.
The old ones.
I mean, it's just kind of, and forgive me because again, I mean, certainly we know that
Right.
men also have, breast cancer experiences,
Yes,
but
they
it's
do.
very, very different. And, as I'm sitting here, and I wasn't going to say it, but you did, you were like, you have the old ones. And so the only thing, and tell me if this is, accurate. I mean, is it kind of like, well, my old car is just not doing what it's going to do, so let me go over here to the dealership and see if I can get a new Mercedes or get a BMW or a Cadillac I mean, is
Well, I
is
don't
it
know
that
if that
kind of thing?
I don't know if it, but it's so funny because, obviously a woman's breast, it's part of the
It's more than just the physical.
exactly.
Yeah.
But, I'm really happy. I really love the implants. Like they look great. They're comfortable, I feel comfortable. They've settled in. Um, yeah, so it's kind of new and improved. That Kirk Franklin store, Blessings in the Storm. So, you kind of have to look, there's an upside to everything, right?
Hmm.
So yeah, so that was the fourth surgery and the final surgery. So it really was a process. And for someone who's not a super patient person,
Hmm.
like I want things to happen, it taught me a lot that, it's a process,
Yeah.
right? From the diagnosis to the treatment, to the reconstruction, to the healing, it's a process. And it really, gosh, September 16th, I think that was my first surgery. So it's been a full year. And, I just learned, I'm so proud of myself. Um,
Well, wait a minute. It's been a year and a day.
yeah,
Today
it's September 17th.
Yeah, so it's
Yeah, from my first surgery.
congratulations.
Yes.
Um, wow, that how ironic. Happy anniversary.
Yeah. So, and again, this isn't everybody's journey is so
Right.
different and so unique. But I was surrounded by so much love and support. Um, in fact, when I thought I was just having a small lumpectomy and I was going to do radiation, I had my girlfriends over actually the Saturday before my surgery was on a Monday. And little did I know, it was going to be more than a lumpectomy, but that circle of love and support has really carried me through. And I really, and I know, I am a survivor, but I really like to think of myself as a thriver because I'm really
Mm.
thriving after this experience. So much positive came out of it, and fortunately, it was caught early,
Yeah.
and I did have, as I mentioned, Dr. Allison Broth performed my 2 lumpectomies, and on the big surgery, the mastectomy, it was Dr. Broth and Dr. Regina Hampton. They
Yes.
performed the surgery. And can I just tell you, Harold, that was a major surgery, as you know, but, seeing them before they wheeled me into the operating room was just like a big hug. I just felt that I was in great hands. And I wasn't worried at all, and representation, that was another thing. Representation is so important.
Explain that when you say representation.
Not that I don't think that I wouldn't have been able to get excellent medical care from providers not of color, but something about having 2 Black women surgeons gave me so much confidence and peace that I knew that they had my best interest at heart at every step of the way. I knew that there wasn't necessarily any bias, whether, we've all seen those reports that you have better outcomes when you have doctors of color, but they just were incredible. The support, the bedside manner, And just knowing that there were things that I just didn't even have to explain to them, that they already understood.
Yeah.
You know?
And I will definitely say, also, Regina is also a friend and, a colleague, and I don't think it's an overstatement to say she is a trailblazer in the field when it comes to breast care
Mhm,
advocacy, and for all women, but as you said, particularly for Black
mhm,
women.
yeah,
And she is an amazing physician, an amazing woman. And since the first day that I met her on this program,
mhm,
I have been, following her healthcare career with great interest.
mhm.
She is a magnificent person, a magnificent surgeon, and again, personally, I am so glad. And I'm not familiar with the other physician who was
Mhm.
there, but I am so glad that Regina was part of your care.
Yeah, and, you know, I and, when you go through something like that, they see you at your most vulnerable, right? And they were just so caring and loving, and, it just means a lot, and I just feel so grateful, I'm full of such gratitude because I know that everyone may not have access, to, surgeons of color, but I'm just so glad I did, and it really made the process. Dr. Bruff always would call, before my surgeries the night before just to check in to see how I'm doing, how I'm feeling about everything. And it meant a lot,
Mhm.
because it's nerve-wracking, it's scary, even at stage 0, knowing that it was still at stage 0. I mean, cancer, you hear the word, it's frightening.
Yeah. And I would imagine, eh, based on what you've shared in this conversation, you figured lumpectomy one and done.
Exactly. I thought I was one and done. And I kept telling Dr. Bruff, I was like, I'm not trying to have a relationship with you.
Right.
I wanted this to be like a one night stand, like I never see you again.
I get
but
it. I understand.
but they were great. And again, the diagnosis, it is frightening, but the treatments, there's so many advances in treatments. People aren't just survivors, but they're thriving. It,
Mhm.
it gives you a certain perspective in life that I probably would have never had if I hadn't gone through this process.
Mhm.
And just and we're all so busy, but I just want to emphasize, we all just have to make the time to to stay on top of our appointments, medical appointments, you know?
So, which brings me to my next question,
Okay.
because yes, you are an extremely busy person. You
Mhm.
always have been. Um, you're the boss
Right.
for Dot Communications. The buck
Mhm.
stops with you.
Mhm.
As they say, you eat what you kill.
Right. Yep.
And but this has been a year's journey at minimum, and an 8-month journey.
Mhm.
How did you deal with the other side of living, of your business while going through all of this?
Well, you know what's so funny, Harold? I always like to say I was like, 2 of my worst nightmares happened, and I survived and made it through. I always, as a business owner, you always think, "What if something happens and I get sick? What's gonna happen with the business?" Right?
Hmm.
Luckily, I have a wonderful business partner, Robert Pierre, who really stepped up to the plate, and I have a wonderful team, and they did not miss a beat. And what you find out is that things will go on without you. We all like to think that if you're not there, it's not going to happen, but I had a great partner and I had a great team, and we didn't miss a beat during this. And through the first two surgeries, I worked during most of it. Now, the big surgery, I was off for a whole month, which I don't think I've not worked for a whole month in probably 23 years,
Yeah,
right?
I would say that since I've known you, that's
Yeah. So, but that was difficult, but I didn't really have a choice. And the big surgery, it was a process. I was weak, I was in pain. Um, but we made it through, you know? And yeah,
Mhm.
so
So the things that in these last, 5 or so minutes, I do want to really kind of drill down on. You
mhm,
spoke about talking to other survivors and going to, support groups and the like.
mhm.
What did you learn from the other people who were in the support groups that you perhaps did not know?
Well, and I hate to keep going back to this, but it's a process. Just like the physical healing is a process, the mental and emotional healing. I just started kind of feeling like myself again, you know? Um and it's a process. You have to give yourself a chance to experience all the emotions, the grief, the anxiety that you feel, the anxiousness. Um
Is
and
that what they told you when you spoke to the other
yeah, because
survivors?
there were times I'm like, am I ever going to feel like myself again? You know? Because you're so stressed, and oh my god, it's so many medical appointments. That alone just takes a toll. So you wonder, am I ever just going to feel like myself again and just carefree? Will this always be hanging over my head? And I can say that I am finally feeling back like myself, where it's not a constant thought in my head,
Mm-hmm.
you know where I'm
You did,
not thinking what's going to happen at my next medical appointment.
you
Because
didn't have any history of cancer in your family prior. Do you know of any of that?
no, we do have history of cancer, not a history of breast cancer. No
Hmm.
history of breast cancer, but there is. My dad had colon cancer.
Yes, I remember.
Yes, but no history of breast cancer. um but it is a process, and you need to ask for help, and you need to no one needs to go it alone.
Hmm.
you know and one of the things that I think so important, especially in our community, so often in illness, it's a secret, or we're not as open, and everyone has to share what they're comfortable with.
Hmm.
But I was pretty open about what I was going through. And because of that, I just got so people were so open with me. People were so vulnerable with me as well. And it may not have been breast cancer, but a challenge that maybe that they had, and how they got through it. Whether it was leaning in on their faith, or they really tapped into meditation, or whatever. But it's important that we share what we're going through. Because unless you share what you're going through, there are people out there that have gone through a similar thing. Again, I'm not trying to reinvent the wheel. I want best practices. Tell me
Right.
what worked for you.
Hmm.
you know I won't be the first. I wasn't the first, and I won't be the last, unfortunately.
Let me ask you this before we close out. How has this changed you,
Hmm.
and what have you learned about yourself?
Gosh, that's such a good question. Well, and this is kind of a cliche. I've just learned that I'm so much stronger than I ever thought I was. If someone would have told me I would have gone through 4 surgeries in 8 months, and still, work part of the time, I wouldn't have believed them. And that I would not be on the bathroom floor in the fetal position.
Mm-hmm.
So I learned that I am, so much more resilient than I ever thought I was. Number two, even though I knew that I had a lot of love and support in my life, until you really need it, you don't know. And, my friends and family just showed up in ways that I didn't even know that I needed them to show up at times. And there were many days that I was in meetings and that I was working, and people didn't know that, a week ago I had just had a surgery. So you never know what people are going through. You know what I mean?
I think that's a good place to end this conversation for today. Deidre, as I said in the beginning, I am so happy to see you looking good, sounding good, healthy, and still on the earth to tell this story.
Yes,
because
I'm
I think
happy
there's so many people who needed to hear this from someone who is able to articulate the ups and the downs, and to tell the truth. Yeah, and to tell the truth. Deidre Owens, thank you so much. It's good to see you,
Harold. And I just encourage all the listeners, if you've put off or if you're late in scheduling your mammogram, do it today.
Yeah, absolutely.
And Harold, thank you so much for providing a platform for everyone to share such important information. You are such a great resource to this community.
Thank you. Thank you so much. We got to keep the sisters healthy.
Yes.
That is the Daily Drum for this Wednesday, September 17th. I'm Harold Fisher. Good night.